report reveals that despite efforts to stop the harmful promotion of breast milk substitute, as regulated in the International Code of Marketing of Breast Milk Substitute, countries are still falling short in protecting parents from misleading information. Uh, can you talk more about this international code? What is actually this code, and why is it important for protecting breastfeeding?
Okay, well, thank you for the question. Sorry. Um, and good morning to everyone who's listening in today. So the Code of Marketing has actually been a standard set internationally for almost 40 years, since 1981. The World Health Organization and its multiple partners has had a standard for how marketing of breast milk substitutes should be allowed. And what that code has always said is that there should not be promotion of breast milk substitutes. It's well recognized, has been for a long time, that breastfeeding is the best way to feed babies, and that when we promote alternatives, we're actually pulling people away to a less healthy behavior. The code recognizes that formula is sometimes important, and so it's not saying we shouldn't have it available to people. In fact, it tries to ensure that it is available when it is needed for those babies whose mothers are not able to breastfeed for whatever reason. But we don't want to be promoting that, and so we have to have restrictions against it. What the code does is, as an international standard, is it tells countries how they ought to regulate that marketing. And basically every country in the world has signed on that, yes, they agree with the code, they recommend that it be used. But then when we actually study the legislation in countries, we find there are a lot of gaps. Not every country has actually put the code in at all into their laws. And many countries, probably most countries of the world, still have significant gaps in the legislation. So they cover certain kinds of marketing, but not all kinds of marketing, or all kinds that are considered to be inappropriate within this agreed upon standard. And so we have gaps there. We also have significant gaps in the enforcement and the monitoring of that. So even when it is against the law, oftentimes we don't catch that, or there's no action taken when somebody points out that, oh, this ad is happening, it shouldn't be happening. Okay, yeah, we ought to do something about that, and then nothing actually happens. So this report that we put out at the end of May is really a call to action, saying we need to do much better as countries to create the laws and enforce the laws that really get in line with the standard that's been around for a very long time.
Right. So when you said that the code actually bans all forms of promotion of breast milk substitutes, can you elaborate? I think this is important actually for our audience. What kind of advertisement or sponsorship or free samples uh, that actually is banned according to the law, and why they should be banned?
Okay. So first to say that the code itself is very general in terms of promotion to the general public. And so all of the things that you just mentioned are not allowed. So any kind of things that we normally would think of as advertising, television ads, billboards, ads in newspapers or magazines, and that would include all of the things that we see in social media or online advertising, is broadly covered within this. But there are also many ways that companies will promote their products beyond just a simple advertisement. And so it might be through information materials. So they'll put out brochures that get passed out in healthcare facilities, that's how to feed your baby. And maybe it's not about infant formula, but there are hidden messages within it that say, well, if you can breastfeed, suggesting that, well, maybe breastfeeding isn't so easy. Well, it's always helpful to supplement. And so they're not promoting their product explicitly, but they are implicitly. And that's also banned by the code. They also promote it through what's on the package itself. So the claims that might be there, this formula is new and improved and now makes your baby smarter. And those kinds of claims are also considered promotional. And we're also concerned about promotion through health facilities themselves. So it may not be the companies reaching directly to moms, but they're reaching out to healthcare professionals and giving them freebies, an extra laptop for you. use in their office, or pens and pencils calendars to put ways that are also used. Are we back now?
I lost you a little bit there, Larry.
Yes. At what point
It
did
was
we get
the
lost? I
connection, I
saw that
think,
it.
was.
Yes, I saw we lost the connection there. So I was saying a number of different ways of promotion, including the promotion through advertising in normal ways, promotion through information educational materials, through labels. And then I was moving on to talking about there's also promotion, not directly to families, but to
Mhm.
healthcare professionals themselves. So the kinds of posters that they might put up in healthcare facilities, or videos that they make available there, but also how they promote to healthcare professionals through free gifts and encouraging them to come to a training exercise, or we're going to sponsor your education. You can come to this conference that we co-sponsor here. And it's ways that the companies that make these infant formulas are able to get their messages to healthcare professionals and create relationships that encourages them to prescribe their products.
Right. So there's actually a lot of different sort of like hidden advertisement or sponsorship that probably parents or healthcare workers maybe not necessarily think that it's actually some kind of promotion, correct?
That's right. These are tactics that the companies use to try to get their products sold and expand their market as much as possible. But the ultimate effect is that it's dissuading parents and healthcare providers away from supporting breastfeeding. One of the things that we're very concerned is that it really just shapes the whole nature of education of healthcare professionals. What we find is that many healthcare professionals don't get much training about breastfeeding, but they get lots of training about what formula is the best formula to provide in particular circumstances. And so the whole education system is skewed toward products and away from how do we actually support mothers with breastfeeding, both in terms of counseling and dealing with any issues that they might have with milk supply. And so the healthcare professionals themselves don't get that education because of the influence of the companies.
Interesting. Um, when you're talking about advertisement, it's not only for infant formula, if I understood, but also like the bottles and the teas, correct?
That's right. We consider it's another way of promoting infant formula. When you show pictures of bottles, it makes people
Mhm.
think about, oh, maybe there's formula here. Maybe that's a way to feed babies with bottles. And so it's a more hidden message, but it's also a message that the companies that make the bottles are promoting that kind of behavior. It is recognized that in some contexts, particularly in Western Europe and in the United States, there's increasing use of express breast milk, and so people do
Mhm.
feed with bottles. But it's still the image that people have that bottle feeding typically still means formula feeding, and so the promotion of those bottles is an indirect way of promoting formula feeding as well.
Interesting. You mentioned about labels on infant formula packaging that it should not make nutritional health claims. Um, can you explain why this is important?
So any mother who is considering how should she feed her baby is
Mhm.
likely to be affected by those messages. That there's something special about this formula. In fact, we often hear people that say they want to supplement because they want those additional benefits that they're getting from formula over and above the benefits that they get from breastfeeding. And they're just not true. And in fact,
Mm.
many of those claims are not scientifically based. Um, and so it dissuades people into saying,
Right.
"Oh, there's something special here that I might need." And beyond the
Mhm.
families themselves that are seeing those messages, it creates an understanding in general society that, well, breastfeeding really isn't all that important because there's so much special about these breast milk substitutes. And so an employer who's thinking about, do I need to support my employee who wants to breastfeed? It creates a mentality that, well, it's kind of her personal choice. She can breastfeed if she wants to breastfeed. She can formula feed if she wants to. It doesn't really matter. And of course, we don't object to this does need to be the mother's decision. No one is saying that she has to do one or the other. But when the employer begins to think, well, it doesn't really matter at all, then he's less likely to be supportive of her need to express breast milk when she comes to work, or to stay out for longer maternity leave so that she can breastfeed. It becomes I don't really care, because they've been conditioned to have this response of these formulas are also quite good, and have all these great properties that have been kind of sold to them because of those claims.
Right. Yeah, I remember when I just gave birth to my first child. I remember some family members were trying to push infant formula because, oh, it says it has vitamin so and so, whatever. So maybe for this kind of reason, that it shouldn't be labeled that way.
That's exactly right. I gave
Uh,
the example of
yeah.
the employer, but it's also the case for the people around you, your family members and your friends. When they are getting those messages, then the whole social support structure for breastfeeding becomes a little bit weaker, and we're not supporting
Mhm.
those mothers in the time that they need to breastfeed, if they want privacy, because everybody kind of thinks, it doesn't really matter so much.
Yeah, and then infant formula be can supplement because it has this vitamin and it's better than breast milk and so forth. Like it
Right.
creates that misunderstanding. We got a
That's
question
right.
from LinkedIn. The question whether what what are the benefits of breastfeeding more than 6 months, and is there any negative uh, side effect if you breastfeeding past 2 years?
So first, in terms of the benefits of breastfeeding, many of the breast benefits continue well beyond the first 6 months of life. People focus on the first 6 months because we say that's when breastfeeding needs to be exclusive. There shouldn't be anything else
Mhm.
being fed to the baby. But just because we do want to introduce other foods starting around 6 months with complementary foods doesn't mean that breastfeeding becomes unimportant. It still protects babies against many infectious diseases, whether that's diarrhea or otitis media, or ear infections, or respiratory infections. It has long-term effects on childhood development of diabetes and obesity, well beyond the time that the breastfeeding stops. And those effects actually depend on the duration. The longer the baby is breastfed, the more protection there is against obesity and type 2 diabetes. Long breastfeeding is also very important for mothers. The mothers themselves have benefits in terms of a reduction in breast cancer, ovarian cancer, diabetes, and those also depend on the length of time that she breastfed across her lifetime. And so, when she has a few children, that time really adds up for long breastfeeding. She's not going to get a whole lot of protection if she only breastfeeds for a few months on each of her children. So those benefits we do need to have that long-term breastfeeding, and it is across a wide host of different health outcomes. The second half of the question, could you restate it one more time? Sorry, the second half.
The benefit, is there any, sorry, is there any negative side
Oh, that's right.
effect of breastfeeding
Are there
past
any
2 years?
downsides? Yeah, are there any
Yeah,
downsides?
exactly.
No, there really are not. People seem to think that there's some harm going to be to the baby psychologically if they're breastfeeding too long. And there's just no documentation that there's any concern about that. In fact, it's quite
Hmm.
good for the baby or the child at that point, to have that relationship with the mother, and keep that closeness for a long period. There have actually been some anthropology studies that have looked at how long mammals normally would feed their young. And if you put the time frame on to being similar across, um,
Hmm.
the across different mammals, for how long do they live, when do they reach maturity and such, it actually would be quite normal, from a physiological standpoint, for babies to be breastfed for multiple years. 6 or 7 years would actually be quite normal. And so this idea that we need to stop breastfeeding very early, it just doesn't make sense physiologically.
Right. So we started getting questions from our audience here on social media because we are live on Facebook, on LinkedIn, Twitter, and TikTok as well. There's a question from Facebook. Does breastfeeding help babies prevent allergies later in life?
So actually, the literature on allergies is very complicated. It and so there's some evidence that actually shows that it is protective, and other evidence that says it's not. Um, and it's I think we're still trying to understand how all of that works. What it appears to be is that it's related to where you are and what the rest of the disease environment looks like there. It's actually important that children are exposed to some degree to some degrees of pathogens. You have to have some bacteria in your environment uh, to develop a healthy immune system to fight those things off later in life. And so, what it is kind of looking like is places that are extremely clean, where people are using a lot of antibiotic cleaners. It's a very pristine environment. That actually breastfeeding is not very helpful there because it's another way of protecting babies against infections, and they don't get the protections that they don't get enough exposure to illnesses or to the pathogens. On the other hand, in places that are not quite as clean, that doesn't mean that they have to be living on the streets and eating dirt all of the time, but where it's kind of a more normal interaction with bacteria, that breastfeeding actually is helpful. So it's a very complicated literature there on allergy and asthma.
Right. Now, when we're talking about breastfeeding, some mothers say that they want to breastfeed, but they're actually not able to produce milk. So, what can they do? What kind of support that they should get if they want to try, nevertheless?
So what's really important is that mothers find someone who can help them, who really is very knowledgeable about the management of breastfeeding. Unfortunately, a lot of doctors don't have the kind of education that they need, partly because of the issues we were talking earlier with the promotion from the companies and the kind of education that they get. That doesn't mean that there aren't good doctors out there, but they really need to seek out someone who has a lot of expertise in how to help with those kinds of problems. There are lactation consultants in many countries, lactation specialists, whose education is specifically how do we support breastfeeding? Because most problems with inadequate inadequate milk supply are related to how the breastfeeding is done. And so it can be corrected with getting a good latch on, making sure that the baby is actually drawing enough milk out of the breast at each feeding. Um, but that needs someone actually observing and checking that the baby is in fact swallowing enough and suckling adequately. And so those problems can be checked and they can be corrected. But if no one knows that there's a problem, it's fairly easy for the milk supply to just kind of diminish over time because the baby's not taking in enough. The milk supply gets, they create less of a milk supply, and then they start realizing, oh, the baby's not growing well, or is having some signs of dehydration, and then it becomes very difficult to try to go back and to correct that. And so what we recommend is that mothers really need to be seen immediately in the first couple days to check that breastfeeding is going well. They need another checkup probably within the first week, what they can actually observe how breastfeeding is going and make sure that they're actually producing the milk as they need. Most mothers can produce plenty of milk without any problem, but we do need to check on that along the way.
Right. Thank you, Larry. So, for our audience who just joined today's WHO Live Q&A, we're talking about breastfeeding and also the International Code of Marketing of Breast Milk Substitute, which includes advertisement, promotional stuff, sponsorship on breast milk substitutes. There's a question from Joanne on LinkedIn, Larry, about advertising through advertorials. For example, when they're talking about how breastfeeding is not possible because of work. What can you say about that?
So any kind of
How
advertising. Go ahead and finish the question if there was more to add.
uh, how workplace should support uh, breastfeeding and breastfeeding mothers, their employees.
Yeah. So any kind of advertising is not allowed by the code, and we would encourage countries that they need to have legislation to make sure that it's not allowed and that they have systems that they can actually clamp down on that. That whether you call it an advertorial or other ways of promoting the product doesn't have to say, here's a can of formula, we want you to buy this. There's much more subtle ways that advertising happens, and the messages are created to encourage people to create to use their products through telling stories about how hard it might be, and kind of create that environment for families. So yeah, that condition of reaching out specifically to mothers who have problems at work. Our solution as society, as countries, as communities, needs to be, how do we actually fix the problems at work, rather than allowing companies to be pushing their products because we don't have a supportive environment. So it's really important that we have national legislation, state legislation, that supports women continuing to breastfeed. So we need to have longer maternity leave. Most countries do not even come in line with the International Labor Organization's standards for how much paid maternity leave should be offered to women. So we need legislation. We need people to be lobbying and fighting for women's rights under international agreements, to how long they can stay at home to be with their babies. We also need to have more support at the workplace, so that there's not a barrier, that when women do want to re-enter the workforce, that they can't continue breastfeeding because there's just too much of a barrier there. We actually did work a number of years ago in the United States documenting ways that women could be supported to breastfeed when they do go back to work, at environments that people said, oh, it's just completely impossible, you can't support women there. They found very creative solutions. Women who were driving buses, women who were working in strawberry fields. It's not just office jobs. There are ways that we can find the accommodations that are needed, and we need to fight for those. We can't fall back on letting the companies push their products because we don't have a supportive environment. We actually have to create that supportive environment for everyone.
Right. Um, in relation to support on breastfeeding, there's a question on LinkedIn. Some women are being ashamed for breastfeeding in public, like in restaurant or in parks. Um, what can be done to support mothers to breastfeed in public?
Well, so we first of all have to have good legislation to make sure that kind of behavior is not allowed. Although that's only going to address the most overt kind of someone being kicked out, and explicit things. Clearly, that kind of judging that happens of women, it needs to stop, and it has to be done through more social change. So it means we need to get better messages out. We need to be talking more about breastfeeding so that it's not something that is considered, oh, it ought to be hidden away. This is a taboo topic. We really need to be saying very publicly that this is normal behavior, and it's exactly how we want to have our babies have babies to be fed. Um, and we just have to create a society in which we are not judging women. While we're very concerned about the judging of people who are breastfeeding in public, I think it's also important to point out the other side. We also don't want to see judgment of mothers who, for whatever reason, do not breastfeed, and that needs to go on both sides. This considering that we know what's right in a mother's circumstances is not fair to them, and we always want to be avoiding any kind of that judgment or making people feel guilty. At the same time, we have to create a society in which the healthiest choice is the easiest choice.
Right. Thanks, Larry. Now, since we are experiencing the COVID-19 pandemic, so we're getting some questions about breastfeeding during COVID-19. Is it actually safe for a mother who is confirmed or even suspected with COVID-19 to breastfeed?
Yes, the WHO guidelines are very clear on this. We recommend continued breastfeeding, even for mothers who have a confirmed case of COVID and are hospitalized and are being taken care of. If she's at all able to hold her baby and care for her baby while she's in the hospital, we recommend that breastfeeding needs to continue, and it needs to be directly at the breast. There needs to be skin to skin contact, no separation. And the reason for that is that the benefits of breastfeeding are so huge that we shouldn't be trying to protect against one immediate possibility. The fact is that the transmission of the virus through breastfeeding looks to be extremely rare. There are very few babies who have gotten sick with COVID. There's really been no documentation so far that it necessarily has happened through breastfeeding. We're not saying that it's not possible, and so there might be some, individual cases where it could happen, but it seems to be so rare that the baby will actually catch COVID. And then what we find is that the infection is very mild in most babies. So very few babies are suffering with any severe consequences of COVID.
Mhm.
And so we need to stop worrying about we want to protect this particular infection, and at the same time create this risk of so many other infections for babies who are not being breastfed. On a global scale, we actually estimate that there are 820,000 child deaths associated with the lack of breastfeeding. And so we don't want to be putting up a situation where we're exposing children to many other risks because we avoid breastfeeding just because we think there might be a possibility of transmission through that. So we strongly recommend that breastfeeding needs to continue. There needs to be continued contact between that mother and baby because of the many health benefits that come from that.
Right. Thanks, Larry. And actually, I can share my personal experience. I had COVID myself in March this year.
Mm.
And I actually continue breastfeed my son, who's 2.5 years. And I put on mask every time he's around me. And he never actually get infected with COVID. So it was, I mean, for me, it was actually probably would be more stressful if I had to suddenly stop breastfeeding. It's more stressful for me and also for him. So that's from my personal experience breastfeeding with COVID.
Yeah,
Um,
it's great. It's great to hear your personal story there, and I'm glad you mentioned the wearing the mask, because that is important. We do recommend that breastfeeding continue, but it does need to continue with the standard infection prevention control measures. We need to make sure we're washing all of the surfaces, anything that the mother may have coughed on. If she needs to be wearing a mask herself so that she's not breathing directly on the baby. The primary mode of transmission of COVID is through respiratory droplets. And so, yes, we want to protect against that. The transmission through breastfeeding, as I said, has not really been documented. But that doesn't mean that we don't want to still try to protect the baby from any infection. And so, as your example has shown, the baby is typically protected as long as we have that kind of respiratory control.
right. Yeah. So put on mask, clean your hands, hand wash with soap and water, or use hand sanitizer, and also clean the surfaces around you. Those are the steps that needs to be taken to if you decide to continue breastfeeding. Correct?
That's correct. That's correct.
Yeah. Uh, and still in relation to the pandemic, WHO and UNICEF actually call on governments to urgently strengthen legislation on the code, and that government and civil society organization should also not seek or accept donations of breast milk substitutes in emergency situations. Can you elaborate more about this, Larry, and why is that?
So this has been a longstanding policy related
Mm,
to the code, but it also stands in many of our emergency policies that we don't want to have donations of supplies of infant formula given in any of these circumstances. While it is recognized that there are some babies who will need formula, It tends to be a fairly small number of children. And the problem is when we get free donations of supplies, it does a couple of things. One, it creates a relationship with the donor. And so the people who are working in the emergencies start to feel like, oh, this is a good company, we want to work with them. And they end up inadvertently promoting the products of that company. The second thing that it does is it creates this free supply of products that can be distributed very broadly, even when they're not needed. And so mothers who are perfectly able to breastfeed in the distribution programs, because, well, this can is available just in case you need it, it becomes too easy to say, well, let's just go ahead and use this to supplement our babies. And what happens in the emergency situations is that that supplementation is probably more dangerous than ever. And so we're putting babies at risk just because of the free distribution of these supplies. We recognize that supplies are sometimes needed, but the best way to handle those is through normal purchasing mechanisms, so that just as the emergency workers are having to purchase supplies for everything else, they need to get those supplies through normal channels so that they can manage them in normal ways and give them out to the babies who need them, but not as a general blanket distribution. And so we find that that's a really dangerous avenue to go when we start moving into free distribution or free samples.
Right. Thank you, Larry, and thank you also for our audience who have sent in some questions. We're also getting some generic questions on breastfeeding, which are interesting. Question from Milena on Facebook, Larry. She wants to know if it's okay to breastfeed while being pregnant.
Absolutely. There's not been documented any harm to either the growing fetus or to the baby who's being breastfed. In fact, there are many mothers that will continue breastfeeding through the time of the birth and starts breastfeeding both children, the newborn as well as the older child. It's called tandem nursing, and there's not been documented any harms with that. Many mothers do find that they do tend to wean toward the end of pregnancy, either because the older child is just getting old enough that they show less interest in it, or she finds that she'd rather be doing one at a time. So it's not highly common to do tandem nursing, but there certainly is no harm to it, and it is certainly good for the older baby to continue to receive those benefits of breastfeeding throughout that time period. And as we said earlier, that long-term breastfeeding is good for the mother.
Thanks, Larry. Another question from Priyanka on LinkedIn. She wants to know if expressed breast milk is equally beneficial, like when baby actually breastfeed directly.
So this is an issue that we're looking at a lot more closely now, and I don't think that the science is really crystal clear yet. We know they're not the same. And it definitely looks like feeding of breast milk is not as good as feeding directly at the breast. And there are a few reasons that we think that is of concern. One of the ways the breastfeeding works is that the mother herself is making antibodies in response to the environment that she has. And so if there's something floating around, some infection, she's creating those antibodies and is expressing them into her breast milk. And those get passed on to the baby and is one of the ways that the baby gets protected. If you express that milk and you put it in a freezer and don't feed it to the baby until 2 weeks later, well, that infection has already passed and is no longer in the environment that they're both living in. There's also concerns about differences of the milk during a feed. So the normal pattern is that the milk at the end of a feeding tends to be higher in fat than it is at the beginning of a feed. And so there's this kind of cyclical pattern to feeding at the breast. Whereas when we express into a bottle and then feed that mixed up milk, the baby isn't getting any differences from the beginning of a feed to another. And so that might be related to issues of recognition of satiety in the baby, that they don't recognize when they should stop feeding, and might be related to long-term development of childhood obesity. There are also concerns that some of the nutrients might be lost when it's stored. It's not a huge problem, but particularly the bioactive factors might be dying out. And there's so many different components of breast milk, some that last for a very long time when they're in the refrigerator or frozen, others that don't last quite as long. And so the science on this issue is very complicated. We're still trying to really understand what those differences are. All that said, if a mother can't breastfeed at the breast, then we certainly would consider that her expressed breast milk is much better than infant formula is. But really trying to find what's the best option. We should always be looking for direct breastfeeding at the breast whenever possible.
Great, thank you, Larry. Yeah, it's quite amazing what nature uh, breast milk can actually do. Like the way it regulates, like what you said, like the fat towards the end. I found that really fascinating how nature can do that.
The biology of lactation is truly fascinating. And if you think about it
Yes.
from an evolutionary standpoint, it makes sense. We are mammals. That what defines us as mammals is this ability to feed our young with this milk. And to think that in basically 100 years, we're going to come forward with a science that's going to completely change that, and come up with something totally just as good as what Mother Nature is able to do over the course of millions of years, just doesn't really make sense.
Indeed. We have two questions in relation to stimulating milk production. From Charney, who asked, how can a mother boost the milk production naturally? And the other question if there is any specific food that can help the milk production.
Um, so the most important thing for milk production is getting the baby latching correctly at the breast, attaching, and drawing down milk with a good feed each time. It's the lactation normally operates on a supply and demand. So the more milk that is taken from that breast, the more she's going to produce milk, and that really is the primary thing that we need to focus on. It is true that there are women who have a little bit more difficulty and need more support with producing milk. Certainly, having more liquids in her diet, drinking lots of water, is recommended to keep up a good milk supply. And there are various herbals that can be tried. There's mixed success on those, but many people do find that certain ones are very beneficial. There's not a strong science that says, these are the specific ones that are absolutely needed. It does seem to vary from mother to mother, and a lot of mixed experience there. In terms of foods, there's not really any specific foods that are recommended or not recommended. Just a normal, healthy diet is what's best for breastfeeding, as well as best for the mother.
Right. A question from Annalisa Tortora. What about nursing a child that is not your own? Can an infant that's not your own benefit the same?
So this is a behavior we call wet nursing, where a baby is not fed by mother, but fed by someone else. And there's likewise not been huge literature documenting the health effects of that. It's not common enough to easily study. It depends a little bit on how it's being done. The benefits of the breast milk itself are probably quite important, and if that mother herself, that wet nursing mother, is healthy and living in the same environment, probably can do just perfectly fine. There's not really a biological necessity that it needs to be the same mother who delivered the baby that is feeding the milk, and so those benefits are probably quite good and quite strong. One of the concerns that we'd have about wet nursing might be if she's living in a different environment. She's not having the same exposures that the baby is having. And so it might not be getting those kind of antibodies that we talked about earlier. And sometimes in some cultures, the problem is that wet nurses themselves have health problems. and so you might be putting the baby at a little bit of additional risk. But if there's good screening and the other mother is doing perfectly fine, there's probably not any significant risks to be concerned about there, and probably quite beneficial for the baby.
Right. Uh, so in relation to that, there's a question about how about using milk banks during COVID-19?
So human milk banks are primarily designed for the feeding of very young preterm babies in the hospital. And it is a critical need for many of them. Mothers who have not gone through a full pregnancy often have difficulty getting their milk supply up in the first few weeks. And so having those babies be fed on human milk, even if it comes from other mothers, it still protects them against many diseases. There's a significant condition in preterm babies called necrotizing enterocolitis that's extremely dangerous, high death rate. And the feeding of human milk, even from a donor human milk bank, is quite important for them. In the time of COVID, there's no particular concern about milk banks. In fact, as I said, it's so rare that COVID could be transmitted, even if there were a mother that had COVID who happened to be a donor. There's probably either zero risk or close to zero risk that could be passed on to the baby. So it's not really a health risk that we'd be concerned about. One of the concerns we have had about donor human milk banking during COVID is just how do we keep the supply up for many mothers
Right.
who are socially distanced and are not able to go out into society. Are they able to bring their milk to a drop-off point, or are they closing off and saying, "Oh no, I can't go out"? Mothers who might be screened medically to make sure that they're going to be a safe donor, they don't go to the doctor because the doctor's offices have been closed, or they're not seeing patients unless they're extremely ill. And so there is concern about being able to maintain that supply right now. As societies are starting to open up more from the social distancing, some of those problems are probably going to become less of a concern. But we certainly need to be watching how this is going and make sure we can maintain a good supply of human milk through milk banks.
Great. Thanks, Larry. One last question in relation to medical professionals. What what can they do? What kind of improvements um, to ensure medical professionals are better educated to support mothers to breastfeed? And this is in relation to what you talked about earlier.
Sure. So they need to make sure that they are well educated on the importance of breastfeeding, and perhaps more importantly, or at least equally importantly, how they can support mothers with breastfeeding. Oftentimes that's not built into medical education, and that's something that we need to change. We need to change the curriculum in medical education. We need to change the testing and exams to make sure that there are more questions about breastfeeding, so that there's an incentive to really get that education. But for health professionals who are already working, they need to seek out those opportunities. In most countries, there are continuing medical education requirements for health professionals. But those requirements are very general, that you need to get medical education on something to stay up to date, but there's nothing that requires it to be about breastfeeding. And so there is a responsibility on healthcare providers that they need to seek out those courses. They need to find the ways to get that education so that they can have the skill sets that they need. They also need to work with the healthcare professionals that have that. So if there are lactation consultants in their community, how can they partner with those lactation consultants? Sometimes they look down on them because, oh, this person doesn't have an MD after their name, so I don't want to refer to them, when in fact they might have exactly the skill sets that they need. Then the final thing I would mention is that they need to make sure that they are educating themselves about their responsibilities under the Code of Marketing of Breast Milk Substitutes. There are many ways that they might be inadvertently promoting breast milk substitutes without even knowing it. That calendar that they accepted and put on the wall that has the logo of some company gives some subliminal messages to families that infant formula is just fine because I saw it at the doctor's office, or he was using a pen from that company. It must be a pretty good company. And they're not necessarily conscious messages, but those are the messages that they need to be very careful about in their own practices.
Thank you, Larry. Yeah, so I think when it comes to breastfeeding, it's actually not only the mother's responsibility or women's responsibility, but also man, family support, healthcare professionals, even government. And with that, I would like to thank you, Larry, for your sharing what you know to our audience on Twitter, Facebook, LinkedIn, and TikTok today. And I would also thank all of our audience. We get many people around the world: Bangladesh, Iran, Albania, Angola, UK, Senegal, Tanzania, Jordan, Brazil, Nigeria, Indonesia, selamat sore, the US, Kenya, Bangladesh, Libya, Sudan, and many, many more. Thank you for joining us today, our live Q&A on breastfeeding. You can find more information about breastfeeding, including breastfeeding during COVID-19, on our website, www.who.int, and join us on our next live Q&A. Thank you so much.
Thank you very much. Enjoyed talking with you today. Bye-bye.